So all of you who are joining us today, all of these esteemed panelists, are folks who have helped us with insights to build towards scale, either by opening up to a whole new realm or understanding more deeply where our value add is and what we need to tighten up or add to our platform accessibility to really make it fully usable for all of the kinds of data that folks are looking for. So I'm going to introduce you all individually with your organizations and then have you introduce yourself. Actually, no. Yeah, I'm going to do the overview first and then we'll come back and have you each introduce yourselves. So first we have Elia Stevenson, who is here from the Foundation for Black Women's Wellness. They have been a wonderful partner in exploring this intersection sort of community organizations and policy advocacy. And I know Elia has some really great news to share, so we'll let her share that herself in a minute. Jennifer Tufts with America Amplified, which was a Corporation for Public Broadcasting funded initiative in 2020 that's going to transform into a second version in 2021 that was aimed at bringing together collectives of media organizations to experiment with different strategies for community engagement and growing local journalism, sorry. Keitra Burnett is with us from the United Way of Dane County, which approached us just over a year ago, wanting to have 100 conversations for their 100th anniversary to understand the impact of the United Way of Dane County on residents and also possibilities for its future. And Elizabeth Hamby from the Take Care New York initiative of the New York City Department of Health and Mental Hygiene, which worked with us to gather conversations, also partnering with community groups to surface the experiences, hopes, and concerns of New Yorkers related to health and wellness. So with that, I'm going to ask you all, we'll start with Elia. If you wouldn't mind, each of you just giving us a little introduction, the mission of your organization, and sort of what made you reach out to us at Cortico and the Local Voices Network. We'll start there.
Yeah, I'll try to keep it brief. Give me the, when I need to be done. We were established, the Foundation for Black Women's Wellness was established in June of 2012. We're a Wisconsin-based nonprofit committed to empowering a generation of well Black women and to raising the visibility and support of Black women's health as a community and public health priority. We energize, mobilize, and support Black women to transform their lives through our 3 pillars, which are education, advocacy, and powerful partnerships. And just a little bit more that I think relates to the intersection of the work with LVN and the foundation. As the foundation was started years ago, our founder and CEO, Lisa Payton Kerr, lost her mother at age 64 to heart disease. And she wanted to do something with what she was feeling, because as she did some more research into her family, she found numbers of women in her family dying too soon from largely preventable illnesses. And as she looked at the community data, national data, she's like, why is someone not screaming this from the the mountaintops? Why is there not more energy around this? Why aren't we talking about this? And so she began Black Women's Wellness Day, which was a one-day event. It started with 40 women in a library in Richmond, Virginia, and is now an event this last year that we had to host, of course, virtually, but to 750 women across the United States. So it began as the need to bring women together to have a conversation, to understand the interconnectedness and intersections of our health and our communities that launched our organization eventually. And my story, very similarly, was one at age 26 in pregnancy for my heart to fail and wanting to understand what was happening with me, joining the foundation as a volunteer, then as a board member, and now as an employee, but really, again, wanting to have a place to have these conversations when you realize you're not the only one. People are experiencing these things and we need to do something about it. And so when we think about that, so here we are as an organization set to really the people that we're fighting for, Black women who are looking to elevate. One of my favorite actually things I've heard said about the Foundation for Black Women's Wellness is that the foundation, Lisa specifically, has moved Black women's health from a whisper to a movement in Wisconsin. And so in order to do that, it can't just be from the perspective, again, of a few Black women. We want to hear the connectedness, the interconnectedness, the experiences of Black women, because we're not a monolith. We're a diverse community who have different things to share. And so we partnered, honestly, mine was my relationship with Colleen and her saying, hey, I think we have something that might help you. We really pride ourselves in being community informed in all that we do and really elevating the voice of Black women. And so this was an opportunity for us to think about the work that we do in advocacy and think about the community that we want to hear from and be able to pull folks together from across the state in a largely accessible manner for conversations about their health and wellness and things that are impeding their health and things that are contributing to their health and setting a vision for Wisconsin. What could it look like for all women, Black women in particular, to be well? And so we reached out with this very specific project. We were going to use these conversations specifically for this blueprint that we're creating. And what we've learned and what I'll share with you is that it has become much more than just our policy blueprint that we're creating. It has become the consistent engagement, being able to elevate in multiple ways, whether it's presentations to medical professionals or presentations to university audiences, or whether it's medical journals that we're really excited to be part of along with Local Voices Network, and whether it's a policy blueprint or embedded into our website. It is elevating the voice of Black women from across Wisconsin, Black women who are in college to Black women who are retired, Black women who have money to those who are struggling, on all sides of politics, et cetera. It's Black women's voice and all the many diversities of it. So yes, we are really excited. One of the ways that we know that our voices are marginalized and oppressed is by their silence, by their omission, by someone else shaping our narrative. And the Local Voices Network, this partnership has allowed those things not to happen, right? It allows us to elevate this. And it also allows us to look at what is expertise, what is data differently. And that's what I'm really excited about the Wisconsin Medical Journal article, because Black women's experiences over and over again are a crucial piece of data that are telling you this is what's happening when we show up in the hospital with symptoms. This is what happened to me. I'm one of these women in this story. It's what happened to me when I showed up and my blood pressure's 200 something over 100 something. And they say, oh, honey, you're just anxious. No, I wasn't just anxious, I'm dying. And they would send me home to die. And this is the experience of another one of the women that we have in this article as well, who eventually had to have a hysterectomy because she was ignored over and over again. And the other woman who lost her baby and almost her life because she was ignored and not listened to. So we're elevating their voices and their stories. And when we came together in these LVN conversations, I was concerned, are people going to share? No, women wanted the opportunity and the platform to share. And when they heard from each other and they heard the consistencies in their stories, they shared more and greater and deeper. And we got something completely different from what we expected from it. And we can talk more about that in terms of some insights I had in working with LVN that was really super duper helpful. But we're proud to have this. We're proud to have their voice in this article. We're proud to be elevating this as in a journal, as peer reviewed and all those other things that mean something to people around what is expertise and what is truth. And so, yeah, I could talk about this forever, but thank you. Hope I didn't talk too long. And I look forward to this conversation to hear about how other people are utilizing this platform so that we can utilize it better ourselves.
Thank you so much, Elia. I realized as I was introducing all of our partners that I accidentally skipped over a slide that actually introduces another partner. So I'm going to invite you to introduce yourself next, Chris Mcnutt from 100 Days of Conversations about Education, about school, sorry.
Sure, yeah, happy to be here. My name is Chris Mcnutt. I'm so excited to hear from Elia and everyone about how they're using this platform. It's really interesting, and I feel like ours is so much different in how we're experiencing this. So 100 Days of Conversations About School is a partnership between 3 nonprofits, Choice-Filled Lives Network, Re-Envision Education, and Human Restoration Project, which is the organization I run. And it's about reimagining education post-pandemic. So we're using this platform to connect teachers to student voice. Often, I'm a teacher also by day. Often by day, we don't really spend a lot of time deeply listening to students. I might hear some comments from students and then make decisions based off of that. Policy leaders might listen to teachers and say, hey, what do you need? But no one is really having long-term, interesting, deep, authentic conversations with kids. And what we've done is we've assembled, using Cortico, a plethora of conversations with 4 to 8 people, most of which are young people talking to adults and community members about reimagining what school is. And we call them big, beautiful questions. So we're looking at things like what makes a good life, what are positive experiences about school, what are negative experiences about school, what does equity look like in school? And just going through and figuring out, well, what does that mean, with the goal of having both transformation through reflection. So just by the act of having the conversation, we're building a deeper connection between students and teachers and community members, but also we're able to grow out this network and have this outcome of catalyzing change. So using the different tools of the LBM platform, we can go in, do some analysis. One of the people on our board is a doctor of research who's going to look at it and publish out what we find, and using that to catalyze change in education systems. My work at Human Restoration Project is centered on teachers coming together and catalyzing systems-based change for human-centered learning. But that's looking at things like restorative justice and some pretty out there things like getting rid of grades or getting rid of standardized testing, or really looking hard at basically what our education system is and what outcomes it should produce versus what it has historically produced. And we're using students to lead that change and talk about what it is that they want prior to us just kind of going and saying, this is what we want. So it's been a really interesting journey. The most interesting thing by far for me has just been listening to students talk at length that aren't my own students in my classroom. I've always, heard from my kids, but it's weird or interesting, I guess, to listen to someone in Florida talk about it or California talk about it. And there's a lot of common themes, and it really is inspiring to hear. We hear like the youth are going to change the world, but hearing them at length talk about this with such authenticity is fantastic. So I really enjoyed the process, and I look forward to seeing what comes out of it here as we wrap things up in April.
Thank you, Chris. I'm going to have us move now to Keitra, going back to Madison and surrounds.
Thank you. I'm sorry, Chris, where are you located?
I'm in Ohio, but the mission is across the entire United States.
Got it. Thank you so much for that. Hello, everyone. I was about to say good morning, but I guess it's good afternoon now. My name is Keitra Burnett, and I am the Director of Stakeholder Engagement for the United Way of Dane County. The United Way is an organization with a mission to, I gotta always look at my cheat sheet, unite the community to achieve measurable results and change lives. And we do that through efforts to really ensure that families are on pathways out of poverty by focusing on the 3 building blocks of a stable life, which are education, income, and health. So at the United Way, in addition to being a funder, we are also a very active partner in our community, and we're also serving the work in the role of convener. And I do that a lot in my position with stakeholder engagement, engaging different groups of people or different communities who may have challenges building trust or communicating effectively. Our United Way of Dane County will be 100 years old in March of next year. So 2022, we are embarking upon our centennial anniversary, our 100th anniversary. And when that project was the community engagement piece of that was assigned to me, because we have a centennial committee. Of course, everybody has a committee in Madison for everything. So the United Way, we have our Centennial Committee, and I am the staff liaison for the Engagement and Expansion Committee. And the initial charge of that group pre-pandemic was to host 100 living room conversations, meaning we were going to go into the homes of 100 of our neighbors and host small, intimate conversations standard way, put up the Post-it notes, take notes, go back, transcribe the notes, and, follow up with folks, what have you. And so when I realized that project was being delegated to me, and I said, excuse me, so you want me to go into 100 different homes, have 100 different sets of Post-it notes, and then transcribe and write a report? I said, better yet, I had already gone through the Local Voices Network training. I had already been a trained facilitator. And so I said, this is a great opportunity for us to partner with another amazing organization in our community called the Local Voices Network. And what they do, and explained what Local Voices Network did. And I explained to the leaders in our organization that this would really, not only streamline the process and help us with all the coordination and all the logistics, it would also help from the perspective of not only having the voices documented on paper, but having an opportunity where people can actually hear the voices of the people who spoke, right? So we know what are the key topics that were discussed, and not only a list of key topics, being able to actually click in the conversation and hear the context in which certain phrases were used. I love the ability of the technology to really close the gap between our donors, which are usually wealthy or business professionals or corporations, and people in our community who are facing some poverty-related challenges. Very rarely are those groups able to come together in a space that allows them to genuinely engage and connect with one another. So the Local Voices Network technology allows us to bridge that gap, and it allows us to not only summarize voices, because executives love executive summaries, but it also really allows them to tap into those intimate conversations and hear dialogue amongst people who are having an intimate conversation. Initially, when the pandemic hit, we were going to postpone the conversations. We were going to use the hearths. We were going to still go around to houses and use the hearth technology to record the conversations. But when the pandemic hit and we had our social distancing guidelines, we were initially going to put the project on pause. But then Colleen and Matthias, as great as they are, gave us an idea of switching to a virtual platform. And that has worked out great. Not only are we now able to engage the people that we wanted to engage, we're actually also able to engage people who otherwise may not have been able to participate due to disabilities or transportation challenges, what have you. Of course, we face some challenges where people may not have the technology or they may not have the wireless access, but the fact that we were able to keep the project going at a time when most people are relying on virtual communication platforms to do anything else, it seemed like a natural next step. So we're really excited. Initially, our goal was to, again, have 100 intimate conversations. And though we have not reached 100 virtual conversations, right now we're at 43 conversations hosted, and we'll be wrapping up our conversations mid-April. We have successfully, though, reached over 200 people that have participated in our conversations, which is huge. And we're really proud of the demographics and the diversity that we were able to attract to the table. And it's also a space where people are having intimate conversations, sometimes with people they don't even know, and we're building neighbors and friendships and relationships. It's also times where we host small conversations where people are familiar with one another, but it still provides an opportunity to share different perspectives and really listen to one another. As an organization, the United Way has successfully, I believe every year we successfully engage over 2,000 people as volunteers. However, we face a challenge of attracting as volunteers or engaging with people who are beneficiaries of the services that we support. So now we're able to connect with those people and collect their voices and make sure that we have equitable reports that represent all of those voices and not just the people who traditionally show up for different types of events in our community. So it has really broadened the voice that the United Way is able to collect and the stories and the perspectives that we're able to collect. And is positioning us to now, I should also say our centennial conversations. We have now transitioned this also to our next strategic planning process. So the voices collected during our centennial conversations will inform our next strategic agenda, which will, of course, leverage all of the voices and stories that we've heard about the different information we've collected, like what are you proud of about our community? What are some things that that are challenges now? What challenges do you anticipate continuing into the future? And then also, what are potential solutions and who are the major players in those solutions? And working with the Local Voices Network really allowed us to develop the script and ask the questions that we wanted to ask and collect the information that we wanted to collect that was also directly aligned with the information that Local Voices Network was collecting anyway. It's about our community and helping people understand our community, all the different players in our community, all the different socioeconomic statuses in our community, cultures, genders, what have you. So it's a wonderful opportunity, and I am so excited that it prevented me from having to go into 100 different living rooms, take 100 sets of Post-it notes, and come back and transcribe all those notes and write a summary. So thank you so much, Local Voices Network. Colleen and Matthias have been amazing partners, and I look forward to continuing to find other ways for us to partner in the future.
Thank you, Keitra.
You're
yes,
welcome.
I think that one of our taglines really should be, liberate yourself from chart paper and sticky notes.
Yes. Yes.
Thank you. I am going to have us transition to Jennifer Tufts with America Amplified. Do you want to tell us a little? This is a similar community listening, but for a very different purpose that was the original purpose, actually, of Cortico and Local Voices Network, to equip journalists for community engagement.
Thank you so much. Let me say that I'm such a fan girl for LVN. I'm an oral historian by training and practice. And I agree, Keitra, that every oral historian, every qualitative researcher needs access to this technology.
Yeah.
So amazing. So America Amplified, as Parisa already said, was we were funded in 2020 for a specific purpose, and then we will see funding again in the future, but the purpose just shifts a little bit. So overall, what remains the same is that we're a national public media collaboration, and we're a collaboration of public media collaborations. I feel like it's a very public media thing that exists. And so we're funded by the Corporation for Public Broadcasting, and we were established in fall 2019 to activate and then support a network of local journalists that are working at 50 stations across the United States. And I heard previous speakers talk about like there was a need to listen deeply to Black women about their experience with health, a need to listen to children about, like, listen deeply, about their experience. And that is what motivated this project as well, a need to listen deeply to communities across the United States. Maybe everyone here knows that journalists overall failed to represent community experiences in reporting around the 2016 election cycle. So a big impetus for starting America Amplified was to try and improve relationships between journalists and communities. And sometimes that meant starting a new relationship with communities that had been left out of access to reporters. I think 1,800 print media organizations have closed in communities between 2004 and 2015, maybe is the latest data that I know. And there's a continuing dramatic decline across the United States in trust in media. And so we sort of have these massive goals to try and tackle all of these things with one project that we thought would be happening in 1 year with a really historic event, which was the 2020 election. And obviously we had many, many historic events that we were grateful that we had this community engagement focus. And so we were able to empower our public media collaboration to report from the ground up on the election cycle, on pandemic and its impact in communities, and on racial justice uprising all throughout the United States. So as Parisa said, throughout 2020, our station partners experimented with many types of community engagement. And basically we taught everyone to engage, listen, report, and then repeat. So really enter an engagement cycle that had all of those steps. And then we partnered with LVN to help us teach journalists how to facilitate conversations where they could listen more deeply. And a lot of those conversations happened off the record and just surfaced community needs and aspirations that then journalists could work to follow up on. Some of those conversations happened on the record, and we used some really incredible audio conversations that happened from people in completely different parts of the United States. We heard a lot of those conversations on a national talk show. So I think our LVN database says that we hosted 116 conversations, and those are a lot of breakout rooms, like individual conversations that happened during like the actual events that we hosted. So I think it's around 20 or 24 events throughout the network. And then, from that, just hours and hours and hours of great conversations. The technology helped us to identify themes. I'm sure everyone has had this experience so quickly, which was really essential for producing a weekly talk show and for producing, quick, nimble media that was providing relevant information to communities throughout all of our partners. And our journalists learning that facilitation skill was huge for us because it really helped put community engagement in practice and helped our journalists shift from sort of more traditional extractional interview practices towards really connecting with communities. And we have seen that is essential for making any kind of improvement with trust. It has to be this authentic connection. And so that was really huge for us. And in 2021-22, CPB plans to support America Amplify. The details are still kind of being hashed out, but we are expecting that a central team will lead a collaboration of 20 stations, this time working with individual stations and not these larger collaborations. And they're going to organize journalists into cohorts. And so one cohort will focus on having in-depth community conversations. Well, probably many cohorts will focus on doing that. And then at least one cohort of 5 or 6 stations will be looking at how to innovate in talk show space specifically, and then using those community conversations to be a part of that. So there's lots of opportunities, we think, for continuing working with an organization like LVN, and LVN completely transformed work and really made it possible for us to accomplish practically work that we set out to accomplish. Oh, I'm in Kansas City, Missouri, and our central team, good question, is in what am I saying? In Kansas City as well. So we had a central team of 7 who were leading the project, 5 in Kansas City, 1 in San Diego, California, and 1 in Rhode Island.
So your collaboration of collaborations. So I wrote your public media collaboration squared.
Yes, that's so good. Oh my gosh, why didn't we talk a year ago? Yes, and we worked with 8 collaborations around the country, and that those collaborations were organized around either they all serve the same region, so like the Mountain West, or they focus on a specific topic, like Side Effects Public Media focuses on healthcare. And all of their reporting is through a lens of healthcare. So there are all these different regional journalism collaborations that are all connected as NPR stations somewhere throughout the United States.
Are any focused on race and race relations? I'm sorry, this probably isn't the discussion part. I can wait.
Yeah, we'll go. Yeah, let me get Elizabeth a chance to introduce the Department of Health and Mental Hygiene project with Take Care New York, and then we'll come back to that very good question, Keitra. Thanks.
Sure. I'm also itching to jump in because there's so many resonant things that have been shared by everyone so far that I have a page full of notes already. So I'm Elizabeth Hamby. I am the director of Take Care New York at the New York City Department of Health and Mental Hygiene. Take Care New York started in 2004 as the city's first municipal health plan. The idea was to look at the 10 leading causes of preventable death and to help New Yorkers understand what they needed to know about how to take action on those causes. There was lots of good advice: eat vegetables, take your prescribed medication, exercise, things like that. But over the years, as we went through iteration after iteration of this planning process, we understood a couple of things. Number one was that we had to confront the reality of racial injustice and health inequity in our city, and that there was no way to create a plan for all New Yorkers without centering the needs and priorities of communities of color in our work. And number two, we realized that while we have a lot of epidemiologists and different kinds of data scientists and experts of many stripes and degrees at the health department, there was one piece of expertise that was missing from our work. And that was the lived experience of New Yorkers, particularly those bearing the greatest burden of health inequities. So Take Care New York 2020, which has just come to a close, was the first time that we went out and systematically asked New Yorkers to prioritize among indicators that had been identified by the health department scientists. Keitra, I was laughing when you were talking because I cannot tell you how many thousands of Post-it notes I have transcribed in my career. I should buy stock. I should buy stock and post it for all those Post-it notes. But that was a good first step. But this year, as we prepared to launch the next iteration of Take Care New York, we realized we needed to take the work further. We didn't need to just know the ranked priority of New Yorkers. We needed to know about their actual lived experiences and understood the way that they were more than just a data point. One of the real challenges that we confront with these data-driven approaches is that data are often woefully inadequate when it comes to describing the intersectional experience of being a person. So a data point can tell us about inequities by race, by age, by neighborhood, and we can develop strategies to address those. But the reality on the ground is that as all of those factors come into contact with one another, our strategies and our responses have to be much more complex. So we were also planning a very robust in-person engagement process that was set to launch on April 1st of last year. Of course, we had a pandemic instead, and quickly changed our strategy, which had initially been, wouldn't it be cool if we thought about how to do something online as part of this engagement? No way, that's going to be too hard. It'll never work. To an entirely virtual engagement process. And after meeting LVN through some partnerships with other organizations in the city, we thought that having a space specifically set aside for storytelling and open-ended conversation would provide an important nuance that was missing from all of our other data collection approaches. And one of the things that was really exciting to me and to us about this work, Chris, I loved your idea of big, beautiful questions. Our big, beautiful question was and is, what creates health? And listening to the variety of experiences and responses that New Yorkers have about that. But through that deep and dynamic listening that we were able to do, not only were we able to hear an incredible range of responses to that question, we also had the opportunity of hearing from our partners, actually, the way that you're asking that question doesn't quite work for us. So in some of our conversations, the partners actually took the discussion guide, tailored it to their community, and asked the questions on their terms, which from our perspective was an incredible outcome. So the work that we engaged in following the conversations and that we continue to this day is really figuring out how to take that deep and dynamic listening that we are able to do in the conversations and apply different methods of sense making to start to really illuminate the insights and good ideas that are coming out of communities, connect those with epidemiological and other forms of data, and propose them as policy solutions to advance issues related to the social determinants of health. So, you know, not much going on that front, as you can imagine. But the work that I think that we can and should continue to pursue through this incredible partnership with LVN, which, you know, like all of the preceding presenters have shared, has been wonderful in every way. I think this idea of more regularly and more systematically both talking to and listening with communities is the key secret sauce that's missing from the flows of numbers and words that we spend most of our time looking at and thinking about. So excited to dig into the conversation and really appreciate you so much for having us, having me here to talk with you all today.
Thank you so much. Thank you all. This is just so rich, and as a few people have already mentioned, there are a million directions to potentially go. I want to, though, pick up on this thread that I heard each of you talk about in a slightly different way, which is that in this landscape where I would say that one of our national pastimes, if we're folks who care about solving some of the big issues of the nation, is to look for data. And often there is a worship of data that comes in the form of numbers and is distilled from the complexity of its original sources, and, you know, carries with it a power because it's brief and can be viewed on a graph, but also, as you all have mentioned, misses some of the nuance. And I'm curious, I know Elia has a really great update around their journal article that has just been published, but I'm curious about the experiences you all have had with making the case for conversation data as a valid data source and as a source of a different kind of knowledge and truth.
Will you repeat that question, Farisa?
Well, I was riffing, so we'll see where I go. Just asking about whether or to what extent you've had to do any convincing of folks who would prefer to look at numbers or graphs to listen instead to voices that don't necessarily conform to a single format, but might give a different kind of information.
Yeah, I can respond to that first. Our United Way Board of Directors is made up of primarily, by design, people who are leaders in our community, either of corporations or publicly elected, publicly elected officials as well, usually someone who represents those offices. And those are busy people, right? And they're the ones who need the summary, the executive summary really quick, the pie chart instead of, you know, the qualitative report. And what we've learned is in the collection of data, a lot of times because we haven't been the best at collecting diverse voices and perspectives, the voices of the people who show up most often skew a certain way in things that they want to see happen or want to be done differently in our community. So the LVN opportunity has provided us the opportunity to collect much more diverse voices, and people come into situations with a perceived notion. If they've already read the Harvard Business Review article about something, they already know it, and you're just giving them an update on whatever that data was. But when you click into one of the highlights and they have a person who is different from them or from a different background than them, really sharing from their heart and explaining their situation or the challenges they're facing, it changes the game. It really makes people want to dig in deeper and listen and learn more, because it is not that person, the author with alphabet soup after his or her name, but it's actually someone who has struggled through and survived poverty-related experiences, which is a completely different type of IQ, right? It's not a degree. You don't have a PhD or alphabets after your name, but those experiences build a type of resilience that is not measured academically, unfortunately. So when people have an opportunity to hear someone who can really articulate those things and help them understand those challenges from a different perspective, it opens a completely different door, and it starts a new, much more genuine conversation about our community.
I love that. I'll jump in. I think that the research is showing more and more that killing people with data, with numbers is ineffective. And that, you know, what we try to do is we name one data point, and that is the average age of death for Black women in Wisconsin is 60. And I know public health people, we like life expectancy, not average age, but we name that. And then we let people tell their stories. And here's why. And they're embarrassing. And we lead the nation in Black infant mortality, right? And we lead the nation in all these things in racial inequality. And so hearing those stories of what people are experiencing are really, really powerful tools. It's interesting when we play these recordings to physicians. After the first one, they're like, wow, that was a terrible physician that must have did that, right?
Mm-hmm.
And they hear the second one and they're like, what hospital are they? Who would let that happen? And by the third one, they're starting to realize, how many more of these do you have? And we're like, oh, well, you can go online and listen to all, you know, blah, 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 you know, opportunities. And it now opens them up to like, okay, I'm the problem, because here I am listening to these Black women and I'm not believing it. And I'm writing it off. And then there's the article you just wrote says I'm not listening and believing. So all of a sudden it really challenges their thinking. And people always remember stories. People, I mean, we know, especially for people in small nonprofits, we tell our stories because that's what you're going to remember. And you're, you know, so these data points, the one thing that we just say is the data hasn't changed. We're still the worst. Largely, and since we've been disaggregating data for 30 years, nothing has changed, nothing works. And so we know that Black women are uniquely qualified to shape the solutions. So let us shape the solutions. And so that's really the narrative that we can use. So it is powerful. People still want to say that was just that individual experience. But the more we have these conversations, and I guarantee the conversation in New York is the same conversation in Wisconsin, is the same conversation in Kansas City. It's all the same conversation. And it's centered on racial inequities, racial inequality. The kids are experiencing in their schools across the nation. And so the collection of these, if you're really to extract the theme from all of these, it's racial inequality, whether it's around the election or anything else. And that's what I hope the big picture from LVN is, all these conversations and these individual pockets and these individual sectors all tell the same story.
Yeah. I think that's a really powerful point. And just to build a little bit on that, you know, I think that the pandemic has really forced us to be much more humble about the inadequacies of quantitative data. When we try to use quantitative data to make decisions about interventions at the neighborhood level, for example, our demographic data is woefully inadequate. we use big categories like Latino or Asian that include a whole range of life, cultural, and other experiences. And numbers will never get us to those solutions and strategies that actually make sense for people. But stories, I think, can offer us those insights and those opportunities to understand the full breadth of the experience of folks beyond just the numbers.
Mhm.
And I'll say from a public radio standpoint, that's our bread and butter, right? Like story, character driven story is our bread and butter. Yet it was very difficult to find on the national scale spots, like national radio shows that have spots available for local journalists for their reporting to fill those spots. The reporting that was created using community engagement practices, using some LVN technology, often we heard those stories were rejected because they were they didn't fit. And so it wasn't that the character driven story wasn't needed, but it was inside journalism ethics, we didn't know how to listen to experiences and give them the weight of expertise. But it's much more common to listen to an expertise sort of responding to someone talking about their experience and call the expertise data from someone, with degrees, and then call the experience opinion. And so so it is I think we came up against that a lot. And in our talk show that we managed, the full production schedule and every component, we pushed for true diversity of voices. And we centered experience as expertise rather than traditional ways of thinking about expertise. And I think that at least in public media, I see that it's really on that scale of innovation, we're in the early adopter space where, there needs to be a new framework for people to think about, how do I listen to two people having a conversation with each other, describing their experiences, and then take something away from that, walk away from that and think about it for myself and learn something without having someone with a degree come in and say, well, I think the reason that they're saying those things is because of this and this. And so it's sort of, we are all learning how to listen differently. And it's a slow climb.
I can jump on this too from an education angle, because quantitative data and education, if anyone has kids or remember what school is like, for the most part, you probably recognize that education reform and quantitative data is detrimental to learning. A lot of us follow Dr. Young Cho's work, and it's what works may hurt. Whereas, yes, we can increase standardized test scores by looking at quantitative data, but as a result, now the majority of high schoolers don't like school. People are bored across the different ranges here of high school, middle school, and elementary school, and more kids are dropping out in various areas of the world, in the United States particularly. And really, it's because people in education are incredibly complex, and it requires storytelling and really a non-standardized model to share that power and figure out, well, what's the best way that you learn? And that really goes back to learning from indigenous ways of knowing. Understanding really any non-standardized model to understand that you can't just input X and get Y from teaching using data.
Thank you so much. Again, a million ways we could dive deeper into that, but I want to give an opportunity for the rest of our Cortico team and some of our advisors who have joined us to ask questions of the panelists. And I'll just ask team, if you could say your name and your role with the organization as you ask your question. I think it'll help our panelists locate you if they haven't already worked with you.
I have a question. I'm T. Marie. I am the lead for conversation gathering and curation. So I'm always thinking about how to share out highlights. And my question is, I have a background in grassroots organizing. So for those who have used sticky notes in the past, I'm just curious as how much time did you see cut down on that process for using the conversations in lieu of that?
I can respond to that one. All of it, right? So if we compare, when we're talking about the time, it's not, well, I'll talk first about the time. So when you're taking down the notes during the meeting, then the reporting out, making sure all of the other tables heard what you had to say, and then there's a summary at the end of it. Then after the meeting, there's the transcribing of it, if that part ever even happens, right? And then there's the summarizing of the report, and there's just so much content that's lost in that process, right? And I would also say that, just lost my train of thought. When we're in the process of using Post-it notes and jotting things down, it takes away from the engagement that you're able to have. It takes away from just the connection that you're able to have with people when you're just having a regular conversation, right? And also when the reporting, or when the curation of the videos is available, not only can you like tap back into the energy of that conversation when you've used the hearth or use the virtual audio, but you can also hear the context in which things, you can also hear the context in which, you can also hear the context with which things were said, right? So it's really understanding at a deeper level what was said, and it's not limited to just words or number of times something was spoken, and it also provides the opportunity for more equity in sharing results too, because if there are 10 people in the room and 9 of them think one way and one person thinks that a different way, instead of in a Post-it note situation and you tally things, well, 10 people said this, so that's the dominant opinion. But the person who has the unpopular opinion, not only do they have an opportunity to voice that, but because we're so engaged, they also have the opportunity to share their perspective or their story or the reason why they feel this way at a deeper level, where people can more thoroughly engage and ask questions about why you feel this way or why you think certain things. So it's not just about the amount of time that's saved, it's also about the type of engagement. And people love to hear themselves, right? So when you give them the recording of the conversations, this is your conversations, like they're more willing to share it, especially, when if they're having a great day. It's like, yeah, my game was on, I was really saying things and articulating things really well. This is how it feels. And it also creates the opportunity for those voices to be heard by others who may not be as articulate. It's like, oh, that's exactly what I meant. That's exactly, so you don't have to be in that room to benefit from that conversation. So we just gain so much more when you move away from the whole jot down what you say and did I capture this correctly, because so much is lost in translation and transcription. It's just immeasurable, I would say.
I really agree. And I would also say, in my humble opinion, there is no more dreadful or dreaded moment of a community meeting than the moment when we all have to go around and summarize what we said on our Post-it notes back to the group. Nobody wants to hear it. And so but I think that we do really want to have conversations with each other, and we do really want to hear from each other, and simply being able to have our conversations in a way that's authentic and organic. And then when we need to go back and listen to the conversation, to just go back and listen to the conversation. I think that it opens up a space for us to kind of build connections with each other rather than just kind of reporting. And kind of to Keetra's point, rather than getting to the end of the conversation and saying, well, 10 people said they wanted red benches and 8 people said they wanted blue benches, so we're going to get red benches, ignoring the fact that nobody wants benches.
Right.
Everybody wants, exercise classes in the park, and so I think that that's really the value add.
I would add that there's a lot of time commitment to this. I want to name this, but I want to echo, before I say that, I want to echo that the benefits outweigh the time. So what I found is that I facilitated all the conversations except for 2 where I wasn't able to attend with an intern. And then we would go in and pull our highlights. And I just want to name that the highlights that she pulled and the highlights that I pulled are not the same. And so just like any data source, qualitative or quantitative, you can use it for good or evil. I hate to say that. So one of the things that came out when we talked about barriers to wellness in Wisconsin, the top one was listening and believing Black women. That was the one that we did this article with, but there was a large one that if highlights were taken without context, could be harmful. So one of the conversations that was had are how the experience of white women and our barriers to health for Black women. And if you just hear that line without the context, because white women are educators, social workers, nurses in these organizations and in the social determinants of health that are impacting our experience in these places, then it could be misinterpreted. So there's a huge time commitment in sitting and being present in the conversations to be able to, when you present that highlight, to provide some context and to shape it, which is why there's some nervousness about just opening up all the conversations, because are people going to do the due diligence of listening to an hour and a half of conversation? We're not that society, right? We want to snip it. Right. So there's that. And then there's the complete difference in which, and I think I had this conversation with DVD and one other person, of trying to then code and theme this data in a way that makes sense to both of us. So here we have a student in the university and myself coding separately, coming back together. We're not getting the same things from it. And what was really super beneficial from my perspective was having Matthias and having Colleen in the background. And listen, essentially they listened to all the conversations right along with us. So they were another partner in, because I was like, what is this? It's like medical discrimination. And I had already went into these conversations saying, I'm going to outline this in the policy blueprint around the social determinants of health. And they're going to talk about education and they're going to talk about wrong. They talked about like root cause isms. Like, I just want to be fully human in this space. I just want someone to listen, believe, and respect me. I want to be able to, whatever. So I was wrong. But then being able to bounce it off Colleen, she's like, well, what I'm hearing is this. And I was like, that's it. That's it, down to its core. So it's still time, a lot of time, and it deserves the time. Thankfully, it's not the time of what Keitra was saying, which is the annoying thing of like writing and typing it up and putting it in a thing, and you don't have that time. So that's wonderful. And you can actually go back to what they actually said, and you can have someone else listen to it so that your bias and interpretation of it isn't overlaid on it. But it's still the thing that I need, that want, hope, wish as AI gets more fully capable, and in some way is like, how do we ensure that these things aren't used for evil? And the other piece is, how do we ensure that what we are what we are bringing it down to requires experience, lived, learned expertise of some sort in order to translate? Because one of the women said, my grandma said that she's not taking any medication for Black people. The doctor prescribed this, medication for Black people. And what they weren't understanding is the doctor probably said, this has been tested, researched, like Black people are a part of the studies, blah, 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 blah. But when people in the classroom that I was playing it for heard that, they're like, what? That's race. There's medication for Black people. And I had to be like, oh my goodness, I have to provide some context for y'all, for you take this out. Now you're going to be going on the social media talking about whatever, So there's still that due diligence. There's still that, cultural translation and summary and all those things that require a lot of time and a lot of effort. And thankfully, I see LVN as a partner in that, or y'all were a partner in that. I made you a partner in it, whether you wanted to be a partner or not. Colleen was that partner. But that is so critical because I'm already coming into it thinking I'm writing a policy. I already know because of data what this policy should say. And I just want to take these little quotes and pop it in there. And Colleen was like, no, that's not what they said. That's not what they said. Right. So it is time consuming, Team Marie is, but it's still beneficial.
And the time is spent on more important things, right? When it's really about a deeper understanding of what was said versus writing notes and making your own interpretations of things. I think that's a huge difference.
And I think also, faster, like sooner, what you're saying, Elia, that like, wait, I need to change something. And that's really valuable. For reporters, it was really valuable because it was like, we think we're going to go into this community and find out about the economic fallout of pandemic. But what they heard from people is that everyone is hungry. So it was like really easy to quickly know, okay, scrap original way of listening and thinking about how we're going to report from this community. And now we're taking on a lens of like, who should we talk to about how everybody's hungry? And so I think that that's really valuable, like, in any kind of innovation, it's like fail fast, like that allows you to fail faster. And then focus, as you guys have all said, your time and energy on like where people are actually saying, this is where we need information, this is where we need resources. That was really powerful for us.
I think that question of time and how and where it's spent is one of the key pieces of what so if we're aiming to repair or create a counter effect to social media ways of sharing information and the speed and the currency of the quick summary of whether it's a data point or just a headline or whatever, the tweet, that taking the time to be in conversation, taking the time to do the listening, taking the time to listen past what you thought you would hear into what's actually being said are all some of the things that we both get the most pushback on and feel like the most critical to the success of our mission at Cortico. So I'm curious about, well, actually, let me just ask if there are other questions from the Cortico team, because we only got one and we're already at our last 15 minutes.
Please, I do.
Great, thanks, Russell.
Russell Stevens. I've have tended to advise on kind of media strategy for Cortico over the years. I have a question about, you all have no doubt brought evidence to the table and in looking to affect change, whether it's polling or maybe focus groups, individual interviews, and so forth and so on. And could you imagine being able to bring LVN conversation highlights to the table regularly enough to sort of consistently impact policy change with decision makers in your communities? And do you see it being a credible source of insight and voices from the community to be able to get to that kind of aspirational role that we all have, which is to actually make a difference in these communities via policy?
Yes. I think so. At the health department, we are kind of thinking about and working with a lot of different kinds of qualitative data with a number of different partners right now. And I think all of that is kind of emerging in parallel with our partnership with LVN. But, kind of going back to what I was saying before about the pandemic and the data humility that it has forced on us, one of the things that is crystal clear to us right now is that the kind of quick policy decisions that we are having to make within the context of a public health crisis have to be driven not only by numbers, but by actual lived experience and community priorities. I think the thing that we need and that, you know, would really kind of value your partnership with in the long term is how we build the infrastructure that makes the gathering of that information routine. Because what we're doing now is kind of, you know, just in time convening people to have conversations, to ask them things in different ways, which is good, but it's time consuming. And the sense making process, it's hard to do sense making on that timeline. And so I think the piece about how you make this routine and how you make it a part of your work. I mean, in public health, we use kind of awful sounding terms like surveillance, but I could imagine a surveillance system of stories, right?
Yeah.
And I think that from an infrastructure perspective is what is needed, because from an application perspective, like we are seeing the value of deploying public resources, public policy, et cetera, informed by these kinds of community perspectives and priorities.
So they have to happen frequently enough and at enough scale, but you have to also be able to deal with that kind of data. You have to be able to actually make sense of it regularly. Yeah.
Right. And I think some of that comes from figuring out how to do that when you're not in the middle of a crisis, and thinking about those kind of routine conversations.
I think what's exciting is that this data is not time bound. So like the stagnant, persistent disparities, again, have been here and will continue to be here. So the one thing that we'll be publishing in the spring or summer here, depending on how quickly we can analyze the data, will be our policy blueprint, at least the preamble, and we are using LVN conversations in that. We started Tuesday lunch walks around the Capitol in our Well Black Women t-shirts to remind people like Black women got you at your seat, and so you need to be concerned about Black women's health. And so we're creating this policy blueprint with that as data. I mean, we'll have some quantitative data points, but we know that the voices of and mobilizing, I don't know where T. Marie is, but mobilizing and organizing Black women with this information to be able to advocate wherever they're seated for a budget, for a policy, period, through this voice is going to be the most powerful. So when we think about what power systems like, locally do we have, I think about the African-American community in Dane County, we may not have as much economic power, but we have the power of media hugely. The power we can create pressure points in that way to be heard. And people hate that just more than anything, especially elected officials, any type of attention. So I think that these voices can push policy. And we constantly hear, we just need to hear more from the people. We just need to hear more, but it's not accessible to hear from the people. Well, we're making it really accessible, and LVN's making it really accessible to hear from the people.
I would add to that too, that because the LVN conversations are hosted in smaller, more intimate spaces, the manner in which people share is more welcoming and more accepted, because you're telling a story or you're talking about a situation to people that you may or may not know, but trust has been built in that space. And it's not the confrontational type of exchanges that happen in lots of public meetings where there's a blaming or finger pointing, you're the reason that I have this problem, or you're the reason because of your decision we're faced with this, this, and this. Instead, it's telling the story from a perspective of its impact, or how decisions have impacted someone's life. And you're able to hear that without feeling blame or shame, which will most likely lead to someone being more open-minded and really listening for potential solutions or different perspectives about a situation.
Thanks. I know Jen was trying to get in too.
Oh, I was just going to say that for us, credibility really still relied on actively looking at who is in this conversation and who is not in this conversation, and making sure that we could try and or that we would keep going to find the people who were missing. And also, you know, something that Elizabeth said that I think is so important, especially for media, is just this idea of like, how do you not consider each conversation, each perspective as representative of larger groups? They're all talking about their personal experience, and you're hoping to do work to try and identify like some systemic things, but you're really also trying to break down like, how do all different Latino people, like Latino identifying, but also identifying in many other ways, like what is their experience of being active in a community in America at this time? And same true for, you know, so many other identity groups. And so that is really hard work to just, so far we haven't found a solution for that, aside from just digging in to build relationships in places where you get access to communities that haven't been a part of the conversation in the past. So I don't know, Russell, if that's really what your question is, but when I just heard you asking about credibility, my thought just went to, there's still like us and our bias
Right.
in the way of getting people into conversations. And so we're really aware of that.
Yeah.
And I just want to lift up that Chris posted in the chat that it's really powerful to allow the folks that you're gathering to lead the conversations themselves. So especially with younger people, having them be the facilitators of the conversations is really significant. And I think part of our vision for growing LVN conversations is being able to equip the community to own the facilitation of the conversations in every way possible, so that as the conversation pathways proliferate, as Liz was talking about, you know, if we're just always in the habit of having these conversations, then when a moment hits, we have all of this information to draw from without having to sort of say, oh, now we care about what you say, what you think. It would be amazing to have that kind of capacity built throughout. I think we have time for one more quick question, if I'm really pushing the time.
I have one, Patrice. I don't know if it's quick. Oh, sorry. I don't know who else was speaking there.
I was going to say the exact same words, but go for it. You got to the stop sign first.
Okay, thank you. Andrew Hayward, I'm also an advisor. I work with Russell on media issues, backgrounds in journalism. So I'm wondering, what's the most frustrating experience you have with mainstream media, pretending LVN doesn't exist, and then bringing LVN into the picture? What might LVN do to alleviate that frustration, if anything? What drives you nuts about the press, and how might LVN help?
As someone who also studied journalism, I would say that what frustrates me the most about the press is the perpetuation of stereotypes. I often share a story where I was once at a gas station later at night, dark, and there was a young Black man who was walking towards me with a hood on his head. And my reaction was to get in my car and lock the door. And I actually ended up crying at that point because I'm a mother of adult Black men, and that very well could have been my son. However, the story that the media tells America is that Black men are monsters and out to hurt you. And I realized how that had even impacted me. I think one of the great things about the Local Voices Network and how it changes that game is that it allows us to hear the positive stories or the good news that the media is not sharing often, because, you know, if it bleeds, it leads, right? So they're going to tell you the stories about the monsters, but not about the roses. So I think Local Voices Network provides a space where we can hear positive news and about the great things that young Black men are doing in our community.
Just to build on what you said, I am literally reading right now Patricia Hill Collins' Black Feminist Thought. And that's something that she says, the power of self-definition is essential for Black women's or Black men's, as we're saying, survival is at stake. And so, you know, this isn't just about what are they reporting, this is about survival.
Yeah.
And so being able to shape that narrative through our actual voice and experience of our community is critical to our survival. And I think that's the big takeaway. And that's what we're missing right now in mainstream media.
But I think I know we're out of time, Parisa, but I think I hear both of you saying that you don't actually expect to influence media very much. You just expect to provide a countervailing voice from a different source. Is that, am I hearing you correctly?
Correct. Yes.
Truth. Yes.
Yes. Yeah, there are campaigns to share positive news about Black men and boys, right? Because, you know, of the stereotypes that are painted about our community. And I don't expect that to change from the media's perspective. So we have to find ways to balance that, or to tell other stories, or the types of stories, or the types of news about Black men and boys. Yeah. So it's not, I'm not saying LVN will ever solve that problem, but it can help show the total picture, or the other side of the story.
Thank you.
Mm-hmm.
Thank you all so much for this rich conversation. I feel like I'm going to be continuing to dwell on the many great things shared, and we've been recording and we'll be putting this in our collection of our own internal conversations to go back to and refer to as we continue to build our process, our platform, and think about our partnerships. So I'm really so grateful for you all taking the time first of all, you know, we're very upfront about the fact that we're still in development as an organization and our process and product. And so thank you all for all of the time that you've offered to giving us feedback in the moment and after your project's finished, about ways that we can improve all of the things that we do. Thank you for trusting us with the stories of the communities that you have gathered for conversations, and letting us be party to the insights and great truths and information that they've shared that change all of us every time we listen to them. I know many of us on the staff team just get a tremendous amount of encouragement and hope and inspiration for our daily work from listening to these conversations. So thank you for all of that. And thanks to the whole staff team for being here and being listeners and being full of heart, mind, and soul as we continue to build this work together. Thank you all.
Thank you. Bye.
Thanks. Thank you. Bye.
Bye.
Thanks, everyone.